New videos every day.
This is Athena Jezik again, talking to you in this series. Another thing that shows up pretty regularly with people is low back pain. Oftentimes it's sciatica, which is the compression or a problem or inflammation with the sciatic nerve, which is a lot of pain that comes out of this hip area. It can run down the leg, and it's very painful and it's very uncomfortable. I've found something that works for sciatica that's quite effective for sciatica, that's I've seen work better than anything else with most people, and that is just working on the sacrum, getting the sacrum to align rather than doing a lot of stuff with the muscle itself. Because for me, every time I work that way, it seemed to be more aggravating for people. Although the problem is sometimes people think they just have to be clawed into the area that hurts, and it's really not the thing that's the best. But without an understanding of the human body, or your own body, and all these ideas about the way things are, won't help you in understanding how things could be unlocked or released by going to a different part of the body, because it's all very, very much interconnected. And if you have hands that have been trained, you can feel where the connections are and you can feel where the resistance is. So what I'm doing right here is just getting a feeling for her sacrum. She does not suffer from sciatica, but I can still show the things that go on and how I treat it. I have had cases where sciatica has been worked for literally months, and within 30 minutes of a sacral pull, the pain has gone away. Now, that doesn't happen all the time, but there have been cases that I've worked like that, and the sciatica pain held. Just a couple follow-up treatments, and they were pretty much out of the back pain that they had been suffering from for so long. So, if you are working in this field, I would say just experiment with, as you get more tools in your toolbox, master what you've learned, and then begin to integrate them, because you can find a lot of treasure in that kind of work. Just remember to cause no harm for anybody. Keep that Hippocratic oath alive, and you'll be contributing a lot of good things to the world. This, I'm right on the edge here, and I'm just, again, getting a feel for this. And even though she doesn't have sciatica, there is some misalignment of the sacrum. So we're going to let that bone begin to float, and it'll come into a softer place. And then I'm going to be pulling it in this direction. It's actually my palm of my hand is right at the sacral level there. Let's see, grab this. This is like the sacrum. That's what we're talking about right there. So we're having my hand here, and just very lightly giving a little traction down. Now, again, what you want to do with this is you want to make sure that your hands, that they engage in the tissue. You don't just put your hand on and put and begin to traction. You put it on and you really integrate. It's like the relationship of one piece of Velcro to the other piece of Velcro. You connect in. There's an integration there. There's a interfacing. And when that happens, then that's when the body is saying, okay, I'm okay with you there. So now we're engaged, and now there's just a little traction happening. And it's not a lot on my part, but it's really pretty much to the body. And if the person on the table is sensitive to that, they will feel things going on. So that's just a way to get started, to feel the position of the sacrum, what direction it's going, if there's any kind of pulsing. And what is happening here is there's a little bit of a wag going on. The sacrum is moving this direction and then that direction with a little bit of a roll. It's rolling like this and like that, which is not the way the sacrum wants to go, but it's not in any position that's causing this person any real pain. However, if it's left undone for too long, and as she ages, there will be more issue going on with this misalignment. Okay. Okay, and then we can do a sacral pull. This could be done either like a standard sacral pull from the, her being on her back, but I'm going to just show you how the mechanics of it is so you can actually see it, because otherwise she's laying on my hand and it's hard to see. You can go back to some of the cranial videos. So the fingers are right at the edge of the sacrum. Let me get the landmark. I am designing these videos in this series a little more for the therapist or the person interested in taking care of people. So you're going to be lined up here with the fingers on either side of the spine. A little bit of guidance right there on that middle, and then the rest of the hand will set on the sacrum like so. And then you engage the hand and you do a traction there as well. What this does, from what I can tell, is it repositions the sacrum at a subtle level. And any kind of pinching or compression that goes on with that sciatic nerve can be relieved because it's going to be opened up, because the body is always going to move toward the right position if it's given a chance to do that. And that can't happen with a lot of heavy, hard, forceful pressure. The body's only going to push back. It's kind of like we are, when somebody really orders us around, we get a little bit, resisting that sort of behavior, that sort of request. But when somebody talks to us about why they want us to do something, there's a more willingness to cooperate and work together. So we carry that over to the body. It's really the same type of principle. And she's doing a nice little stretch, and I can feel the sacrum kind of bubbling and popping and finding a new position. And it is lengthening. There's a stretch happening between L5S1. Now I can also put my hands here and just kind of anchor that lumbar region. And there's a lot of swimming. It's really finding its way. Now, also, as the sacrum is moving like that, you're also getting changes going up the dural tube, and it's happening in the vault of the cranium as well. So in a sense, there's a little cranial work going on right now. Okay, so that feels nice and stretched. There's warmth. Sometimes you'll feel heat where there wasn't heat before. And the sacrum is not wagging. It's doing the rock the way it should, which is a rock that's going more like this. Before it was doing a roll back and forth like this. So we've corrected that just in itself. There's one other thing that sciatica can be caused from, and that is from full bowels that are pressing against the sciatic nerve from the inside. So you can have some bowel issue, and that can also cause some inflammation or some problems with the sciatic nerve. So if the back work doesn't help anybody, you might want to work the some visceral manipulation or some abdominal massage to see if you can get some peristalsis going. That's probably not a good thing if it's coming from the abdomen, because there's probably some things going on with digestion or with bowel creating this inflammatory condition. So it's hard to know exactly what's going on without a lot of testing, but when you get an idea for what's going on, and a lot of times just a little work to correct things will show you what else to do to help the body along, and the body will move towards wellness. We do not need to be sick. We just do not need to be sick. In fact, it's interesting because there's really no mention biblically of any society or group of people that was commissioned to take care of a group of people's health. It used to be people just knew things, and the history of modern Western medicine is quite interesting to follow. My hand is on the top, just guiding the dural tube now.